welcome to Care for Caretakers, presented by NAMI Greater Los Angeles County and the Connect with Hope Warmline team. We'll give everybody a minute. Happy Friday. We made it. Hopefully you're all staying cool if you're here in Cali. Awesome. All right. Well, I'm going to turn everything over to our host for today. So, Patria, would you like to kick us off?
Hello, everyone. Yes, I will be happy to kick us off. So, welcome, everyone. My name is Patria. I'm one of your Connect with Hope Warmline Specialists, and I just want to welcome you all to our Care for Caregivers webinar. Happy you all are here. Thank you so much for joining us for this important session. I'd like to introduce Dawnel. Hi, Dawnel, our Director of County Programs and our Supervisor for the Connect with Hope Warmline team. Also, everyone say hi to Cindy, our Spanish-speaking Warmline Specialist. Lastly, but not least, let's welcome our guest speaker, Yvette Cordero. Yvette is a Special Projects Manager for the USC Edward R. Roybal Institute on Aging, bringing 30 years of public safety and law enforcement experience to her work. She now oversees critical caregiver research studies, a mission close to her heart, having personally been a caregiver for her parents and family members. Please welcome Dawnel, Sydney, and Yvette. Hello.
Hello, everyone. Hello, welcome.
Okay, and before we dive in to the presentation, I'll review a few housekeeping guidelines and share some helpful information about NAMI GLAC. So let's begin with our first slide, our guidelines. So please note that this is a safe, respectful, and confidential space. Today's webinar is being recorded. If you have any questions, please type them into our Q&A section. We'll answer as many as we can at the end, and we'll follow up by email if you run out of time. Slide 2, let's go on to who is NAMI GLAC. NAMI, Greater Los Angeles County, is the nation's largest grassroots mental health organization. We serve communities across Los Angeles County to promote wellness, recovery, and dignity. We support individuals and families through free support groups, educational classes, advocacy work, and our Connect with Hope Warmline. How we support you. We offer free resources tailored to your needs. We have support groups that are free, safe spaces for peers, families, and our specialty support groups that are there for the LGBTQ plus community, Spanish-speaking communities, and our transitional age youth community, our TAY community. We offer education such as free classes like NAMI Basics and NAMI Family to Family. We also have resources, local service referrals, and for community events. And you can learn more. You can visit us at our website at namiglac.org. And for a full calendar of events, you could check us out there. And so our Warmline, if you need someone to talk to, our Connect with Hope Warmline connects you with certified peer specialists like myself and also Sydney, our Spanish-speaking Warmline Specialist, for free, confidential, and empathetic support. And in this slide, you can see all of the information you will need to contact us. So let's move on to the next slide. We're excited about this. Our NAMI GLAC 2026 conference, Stronger Together. We're thrilled to invite you all to our conference, Stronger Together. This incredible event brings together a diverse community of clinicians, researchers, advocates, caregivers, and individuals with lived experience to connect and learn. Again, in the slide, you could check it out when, where, and how to register. November 11th, 9 a.m. to 4 p.m. at the California Endowment Center right by Union Station in downtown LA. And you could register. There is a QR code on the screen, or you could visit our website at namiglac.org/conference to secure a spot. You could also follow us on social media at NAMI GLAC on Instagram, and we'll be sharing that information through those channels as well. And today, we are moving on to the subject for caring for yourself as a caregiver. Again, yes. So also we can connect. You could see the information on the slide there on how you can connect with us through the QR code, all of the information there, and all of our social media outlets that you could tune into. We'll post all of our events and everything of the sort there. So check us out there. And lastly, we'll get on to the webinar. So today's subject, we are focusing on you, the caregivers. Caregiving takes immense emotional energy, which is why you need support outside of this relationship with the person you're caring for. So this work requires emotional energy. You need support outside of this relationship, which may include therapy, support groups, or trusted people that matter. Trusted people like us at NAMI GLAC, through our Connect with Hope Warmline, through our support groups, our connection support groups, family support groups. That's an important part, to be able to share space with people that are going through a similar lived experience as your own. Also, grief is normal, even when love is present. That could be very difficult sometimes. But again, not to neglect your own care. It's not selfish. Self-care is not selfish. It's necessary. So finally, just a reminder, drop your questions in the Q&A and we'll answer as many as time allows. Okay. So thank you again. And I'm going to move it on to Dawnel and Yvette. Thank you.
Thank you.
Yvette, it's all yours.
You able to see my screen?
We are, yes. Thank you.
Okay, wonderful. Thank you, everybody, for your attention to this great topic that we're going to discuss today. My name is Yvette Cordero. I'm with the Roybal Institute on Aging. As they mentioned, I am the Special Projects Manager, and I have overseen numerous caregiver studies offered by the USC Institute on Aging. Our primary lead researcher is Dr. Maria Aranda, and she is the executive director at the Roybal Institute, and she has over 40 years of experience working in caregiving with those patients with memory loss, caregiving with those persons that have somebody who have Alzheimer's disease. In addition to that, she is part of what we call the OR Court for the Alzheimer's Disease Research Center. So she also works with one of the 40 Alzheimer's disease research centers throughout the nation, and USC is one of them. UCLA has another Alzheimer's disease research center, and so does UCI. So she has dedicated her work to caregivers, to Latino caregivers, and to African American caregivers. So with her work, we're bringing you her presentation today. Caregiving came to light very early on in the 1980s with former First Lady Rosalind Carter. She began to take an interest in caregivers and realized that caregivers were being somewhat neglected, so she created an institute. And she has a very famous quote that those that are advocates for a caregiver want to remind caregivers of who they can possibly be in the spectrum. And she writes, "I like to say that there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." And you're probably now being able to identify where you fit in one of these 4 categories. For myself, I have now reached the latter part of being a caregiver because both of my parents have passed away. But even though they may have passed away, I now have friends that are currently leaning on me, asking, can you chip in a couple of hours while I go to a doctor's appointment? So now my role has changed, that I'm not there 24/7 caregiving, but I am pitching in and helping my friends in need. So I hope you can figure out where you're at in this spectrum of caregiving. And the work of caregivers is very important. We need to understand that there's a gap in information and resources that are needed for caregivers. What does a family caregiver mean? Basically means you are the caregiver and you're caring for somebody who has a chronic or health condition. Those chronic conditions can be diabetes, they can be a mental health condition, they can be a liver disease, they can be anything. But all in all, you are still a caregiver regardless of what the condition of the person has. Now, yes, we do our work in memory loss and Alzheimer's disease. And there is a difference between a caregiver who's caring for somebody with a medical health condition versus somebody who's caring for somebody with a cognitive impairment condition. And the difference between the two is the person who has the cognitive impairment can't make decisions. It's very difficult for them to process. So you, as the caregiver, take some additional steps in helping that individual prepare for decisions and to do daily living activities throughout the day, such as the person with memory loss may not know how to turn on the shower handle when it's time to take a shower. That may have lost, but it's a simple step, but that's because of the cognitive impairment. Now, let's go back to you being a caregiver, and you have been laid upon this role of a caregiver. This role of a caregiver can either be voluntary, you could be voluntold, or it could be as a matter of a legal request. What I'm going to ask for you as a caregiver is understand the person that you're caring for, their diagnosis. Take some effort in understanding what their condition is, because it will help you understand why the person is reacting, acting in a particular manner. Go online, read information, call up telephone numbers related to your specific medical condition of your loved one. Find the joy and the purpose of why you are here right now caregiving. Your loved one will most certainly appreciate it. We have to support the loved one. We have to go with them to appointments. How do you prepare for appointments? Think about that. For me, I always went with a notebook. I took my notes with me and I wrote notes because I know if I came back home, family members were going to say, what did the doctor say? What did the doctor say? So at least I had my notes. If they needed a treatment plan and it had to be followed, I had to understand the treatment plan. I had to understand when were the appointments, what type of medications were going to be taken. If medications were part of this treatment plan, I have an Excel spreadsheet. I created the Excel spreadsheet. I wrote what the medication was, the amount that they were supposed to take, when they're supposed to take the medication, because it never failed. When I went to ER or when I had to call the ambulance, the first things I was ever asked, what is the condition and what type of medications were taken? So I took it upon myself to create a medication list, and it helped me a great deal. In addition to that, I had documents next to my home by the front door that if the paramedics were to come in for whatever reason, they had the medical conditions, the medications, along with the medical directives of my parents, because they seemed to ask me, did you have this? And of course, the first time it ever happened, I never had it. So I had to go research, go find it, make copies, and have the notebook next to my front door because somebody always needed it. if I had somebody come in for me for a couple of hours, I knew I could walk away, and I had that information just in case for emergency purposes. Caregivers, you are valuable. We cannot do it without you. And just remember, you are special to that loved one. This relationship between caregiving and your loved one is a one-on-one relationship. This relationship is only between you and that loved one. And it's a caring and loving relationship, and they rely heavily on you as a caregiver. Please take the time to listen, to understand their concerns, because just that short mention of listening or them knowing that you listened can help a great deal. The difference between somebody that has a medical condition versus a cognitive impairment condition is we start off in the initial stages of somebody having memory loss. And as time goes on, we are going to see the progression of this loved one going into the different stages of cognitive related illnesses. So you're going to go from not being able to tie your shoe to basically down the road in some years of possibly not being able to speak, not being able to eat because they cannot remember. So understand that caregiving for different types of illnesses is important, and understanding what it is a great deal. In dealing with daily functioning for persons with dementia or mental health, there's a lot of areas that affect that loved one. They may have a short attention span. They cannot make major decisions. They may have short-term memory loss where they don't remember what occurred yesterday. Did they eat 5 minutes ago? What occurred? What was said? They may have difficulty speaking. They may have difficulty moving around or their sense of perception around them. And sometimes their social skills may be hindered, such as you may be out in public and somebody may say, well, why is that person morbidly obese? And usually we say, shh, shh, don't say that, that's rude, that's not nice. But you have to understand that sometimes with persons with dementia or having issues related to social skills may not know that that is not perhaps nice to say in public. So if you understand that all these different areas get affected, then it could help you go through the days and weeks of caregiving. A couple of stats. For caregivers with dementia, right now, there's about 11 million caregivers in the United States. Just recently, maybe 2 days ago, within NAMI, they have on their website some articles that there's 63 million caregivers who are caring for somebody with mental health. Those are a lot of numbers. And most of the caregivers that we're finding are females and Latinas and African Americans. So we as women take up a good number of data as far as us reporting that we are caregivers. So we as a family, we take on the burden of caring for our loved ones. Right now, it is $18 billion of unpaid health or care that we provide to our loved ones. Basically, that means we're giving our caregiving time away for free. But of course, we do it because we love our loved ones, and we do it for feeling good, not because we have to, because we have a true commitment to the person we're caring for. In total, caregivers give about 30 hours of their week to their loved one for free. Those are unpaid hours. That's a lot of time for us to do this in an average of a year. We, as an entire family, borne that cost, and we share that cost 70% of our lifetime cost of caregiving. Again, a lot of money, a lot of time that we are giving to our loved ones, and we are taking it onto ourselves. What's happening now? Right now, the federal government is cutting down hours. So again, we are still looking and trying to find programs for us to help us with caregiving. So if we can understand that costs are coming, perhaps we can prepare. How do we prepare? Perhaps you can rely on others to help you with caregiving and ask individuals to come in. Again, one of the things that we're learning is that we are the backbone of our country's health and long-term care services. We are the ones that provide the care. So these are the 4 areas in which caregivers are impacted. Financially, we've made mention, we're paying for that out of our own pocket. Health-wise, are we neglecting to go to the doctors? Are we neglecting to take care of ourselves? Maybe now is the time for you as a caregiver to say, wait a minute, I do have a pain in my hip. Let me go see what that is about. Let me take care of it. Let me handle it. Socially, have you all of a sudden stopped going out with your friends or visiting with family members for various reasons? Perhaps you may not want to take your loved one with you. Perhaps you don't have a car. Perhaps you don't have a ride to go somewhere. Perhaps you may not have the funds. That will affect us. If we don't socialize with other individuals, and where sometimes we can air out our concerns and frustrations, that can impact us. Personally, I'm going to go in this route regarding emotionally. How are we doing emotionally? Do we have anger? Are we upset because we're bored? Do we experience sadness? These are things that we need to consider. And if we can say yes to some of these, perhaps it's now time for us to take an extra step as caregivers and get some respite care for ourselves. Perhaps do something extra for ourselves, because by us doing something extra for us, it can alleviate a lot of future stress. Can we go find spiritual wellness within a church? Perhaps doing Pilates, going to yoga. Is there some sort of program where we can develop our self-growth? Perhaps I may want to learn how to crochet, that one craft, that one exercise, that one sporting event that you want to do but haven't done it. Perhaps now is the time for you to take action and go and do it. What is stress? Stress, we all experience it. We worry about many different things. How are we going to care for our person? How are we going to make our bills? How are we going to make the next payment on our home and for rent? So this is a response that we all go through. But what we need to determine is, how are we going to respond to stress? And that's a key point in this presentation, is we have to learn how we respond. Some of us respond, we're cool, we go with the flow, everything just goes off your back. Others, you tend to be a bit concerned, you think about the issue that's at hand, and then you're able to attack, figure out what is it that you need to do to rectify your situation and make yourself less stressed. Other times, individuals have a tendency to go from 0 to 90, and they're very concerned, and so concerned that it it affects the changes in their sleep pattern and in their eating. So we need to figure out where we, as a caregiver, am I person number one? Am I cool? Am I person number two? I take things slow, or am I person number three, where I tend to go from 0 to 90 immediately? So what we have to do is, we have to learn how we're going to manage our stress. And I'm going to give you a couple of tidbits here, how we can respond to stress if somebody who has dementia or mental health issues. So one of the things we need to do is, as I said, reach out to other individuals to help us. Do we reach out to other family members? Do we reach out to friends? Do we reach out to clergy that can help us get assistance and resources? Do we reach out to NAMI and ask them for professional guidance and how they can help with caregiving? Do they provide respite care? Do other organizations provide any other type of resources that you need? Perhaps maybe at some point in time there may be a housing crisis that you're going to experience. How are you going to navigate through that? Additionally, training. There are a number of caregiver resources and training courses and free programs that are offered for caregivers. I'm going to ask you take the time out to do some research, because there are resources through the county, through the cities, online, through the library, through different states that can provide information, training, videos. And what we've learned is a good number of people ignore the resources that are available. And we've learned that when myself and our team go out into the public and we do community events, we come back saying, hey, did you know that they give out this and this and this? Do you know that they give out some credits for electricity? Do you know that they give out free phones? Do you know that they give out bracelets to loved ones who have memory loss? That is a free program through the county. So there are programs out there for caregivers to tap into, but if you don't do the research, you won't find it. I like to say the squeaky wheel is the one that gets oiled. Sometimes you may have to call once or twice to get somebody's attention to ask for assistance, and that's okay. Learning new strategies with problematic behaviors. I'm sure NAMI has a significant number of documents, information, literature, pamphlets on how somebody who may have an eating disorder, as to how to deal with that, or somebody that has schizophrenia. There are many avenues in which you can do the research yourself, find it, or ask other organizations to help you for that. One of the other things is taking the time out for yourself. It's okay to be able to say, can I just have 15 minutes to myself to go out on the patio and just look at my flowers and relax for a minute before I come in and help you with X chore? You can do that. I give you permission to take a break when you need it. And you're the only person that's going to be able to judge when you are able to take that break. Sleeping. What we've noticed is if your sleep patterns are disrupted, it affects many areas of your life. And we need to get sleep so that we can continue to caregive. We need to get sleep so that there may not be a high susceptibility of possibly getting dementia as a result of lack of sleep. We have to eat healthy. And sometimes grabbing the first thing in the refrigerator, the most easiest thing, the potato chips on the side, is not the best thing. We have to eat regularly. We have to make better choices for us and for the loved one. I'm going to ask that you think about what you can do as a caregiver and do an incremental change. I'm going to ask for you to find 2 things that you can change, not drastically, but that you can do on your own and it's easy to do. And commit to changing 2 small things to help you get through caregiving. Some additional ones. What happens is, I know for myself, I tended to get down on myself because my mother's heart rate level wouldn't go down. So I thought it was because of me. I thought it was because I wasn't doing something right. But I learned was sometimes medications take 2-3 weeks to get into the system in order for them to work. I was beating myself up for her heart rate not going down, and I was blaming myself. So think about how you're going to overcome those situations where it may be a negative thought. How do we overcome it? Let's get rid of those thoughts and let's be positive. As you know, I did mention, let's look at providers. Let's go get yourself checked. Please do that. It's imperative that you take care of your health. I found being a perfectionist, my OCD, again, was another hindrance. Everything had to be cleaned. Everything had to be disinfected from my parents when they were with me. I realized that it's okay that you could have a dirty table where mom and dad were eating at. It's no big deal. Let that go. There's something else bigger and better to worry about. One of the other things that I learned was, why am I the caregiver? Why is it that I'm the one within my family taking this on myself? Why isn't anybody helping? I found purpose. I found gratitude. And I found value in what I was doing. And with that, I was able to become a better caregiver, a better daughter, a better sister to my brother and my sister, because I was able to learn that I'm a caregiver. I'm doing the best that I could do. Caregiving is emotional too. There were days that I would cry. There was days I thought, man, is this even worth it? But I needed to make sure that both of my parents, the final stages of their lives, were happy and there was harmony within the family. I needed to know that once mom and dad passed away, I did the best I could. There was harmony and there was no animosity within the family as a result of me caregiving. I grew, I think, as a person. Personally, I think I grew more knowledge in caregiving. And I think that's going to happen to you also. With time, you grow, you get better, and you become wiser. And just the other day, I caregived for my friend's mother. And I remember telling her, you do know that the condition of your mother has changed from 1 week to the next. And your mother is bedridden now, and your mother will have to be changed while she's lying on the bed. And my friend looked at me, she goes, what do you mean? I said, there are videos there are ways, there is a technique in how you change the bed linens and how you change a person while they're bedridden. And the light turned on. She says, I didn't even think that that was going to be something that I was ever going to have to deal with. So remember, things do change for you as a caregiver. We're here to help. The Institute is here to help. I will share my contact information with you. We currently have a study for caregivers who are caring for somebody with memory loss. If you know of anybody that is a caregiver, is Spanish speaking, and would like to participate in a research study free of charge, we're here to help. Help navigate caregivers who are caring for somebody with memory loss. I'd like to thank you. I was not able to see if there was any questions while I was giving the presentation. I'll be more than happy to take any questions on or help. Here is my contact information. If you'd like, you can take a picture of it. I also do know that Dawnel is going to provide the information to you related to our presentation and my contact information, just in case either of you would like any information or guidance on where to get resources as a caregiver.
That's amazing. Thank you so much, Yvette. And to your point, actually, many of the questions that came in was, can we get access to the presentation and to, be able to connect with you? So thank you for sharing that. And to those of you who asked in the chat, yes, we will actually send out the recording of this webinar. Give us about a week or so to be able to do that. And a part of that email will also be including the presentation information, further information about the study that Yvette and her team are working on. And you will also then have my email as well. And I know there was a question from Courtney specifically in the into the chat. And so Courtney, when you get the email from me, I would love to respond or chat with you further about what your question was. We can kind of chat through that more offline. And I just want to say thank you to you, Yvette. It's interesting. I took a ton of notes for myself, and I just want to kind of reiterate a couple of the things that you mentioned.
Absolutely.
Really, as a reminder, I appreciate that you really talk to family members because I think oftentimes family members don't see themselves as a caregiver. Right? I'm daughter, I'm,
Yes.
sister, I'm whoever, but really you're also the caregiver. And so I just really appreciate that you brought that particular role up specifically.
Absolutely. Let me just give you, when we're out in the community, our team, we ask everybody that we approach, are you a caregiver? And we tend to see no, and they walk away. But then when we ask, do you care for an older adult at your home? Do you care for your mother? Do you care for your grandparents, or your grandparents are in the home? Then they stop and they turn around. They're like, yeah, I do.
Yeah.
And so that's when they realize, wow, I do. And the other issue is this a caregiver that's a sandwich caregiver? Caring for that older adult who has a medical condition or a mental health condition, but also caring for a young child. So what happens is this caregiver is being sandwiched in between both. Where do you navigate and who do you give more attention to? So the caregiver stuck in the middle, trying to do a balancing act. Balancing becomes stressful. So hopefully some of the caregivers today that are on the presentation, they may see themselves in that role as a sandwich caregiver.
Yeah, actually, one of the comments really speaks to that, caring for two individuals in her family. She noted just feeling really overwhelmed and not sure how to take time for herself. So do you have any advice for those who feel like, where do I even find those 10 or 15 minutes?
One is deliberately making an effort to establish a network, meaning Who can I call upon to help me in need? So you may have a sister-in-law, the next door neighbor, or somebody else. And you have to have these people in your circle, and you have to welcome these people in your circle. And it's okay if your house is a mess, because you're going to need them, but you have to identify them. You just can't say, can you come and help me right now? You may want to say, Mrs. So-and-so, I have an issue. I have to go to a doctor's appointment in 2 weeks. Is there any way that I can schedule you for 2 weeks? Making those advance calls, don't wait for the last minute, but identifying who that circle is.
Yeah, that's really good. Thank you for that. Kind of another just comment to something you said. Somebody else, Stacy, in the Q&A noted that the file notebook or that folder that you spoke to, she notes that's how she cared for her father before his passing and now her mother. And she said that's been just a godsend to just be prepared in that way. So I wrote that note down as well. And the other thing I noted was taking the effort to understand their condition. So
Yes.
For those who are caregiving for somebody with a mental health condition, what is the diagnosis, and really diving into what does that mean for your loved one, and knowing that everybody's journey is going to look very different, right? So you might have somebody who's diagnosed with depression, anxiety on this side and somebody on this side, and their journey looks so different. So really just that reminder to take the effort, take the time to really understand their condition for them and what that means.
One of the other things I did was in my phone, I put in emergency room visit, and then I write down everything I have to take with me. Because every time I had to go to the emergency, it was an emergency. I wasn't ready with a bag, but I bring up the note and it says computer, charger. The charger ends up being an important factor. But did you know that the charger is not only for you, the charger is for that loved one that's in the hospital. So I had to take 2 chargers because my mother would always be there. When are you coming? When are you coming? When are you coming? And so I even on the list snacks, because you're going to be there at the hospital for X number of hours and the cafeteria is going to be closed. You're going to get hungry. And so I have a list.
Yeah.
The list of right by the door, that was so important to have, and I still have it there. I haven't gotten rid of it, but it's still there. Yeah. And I've now developed mine, my personal one, with my directives, my medications, and who my contact persons is. Because if I'm home, something happens to me, I dial 911, they break down the door, I could tell them, go to the door. So now it's also thinking about yourself.
Yeah, absolutely. Just curious, that list you mentioned of, like the charger and the snacks, like I would never, honestly, I don't know that I would think of that. Did you find a list online, or where did you just trial and error?
Yeah, it was just, it's just me. I have it labeled items to take to ER. And I have it, and I take the list of her medications with me. I take the list, I develop a list of her doctors. And they were always with me, because if a caretaker came home and wanted to know what medication she had, the paper was always there. But that paper has to be updated, because you may be taking 1 tablet of this today, you visit the doctor tomorrow, and then it changes over to 2 tablets. It has to be current. And I saved each Excel spreadsheet with a different date, because sometimes I had to reflect back, when did that change occur? And I was able to find it.
That's amazing. Yeah. So I would just encourage those listening. And again, it's understanding your individual situation and what that is that you might, what you might need for that specific situation. We have a question. Yes. Okay. So the question has to do with resources specific to mental health conditions. And so, Mary Lou, I will include in the email some resources available to you. I just want to encourage all of you. There was even a comment here around not having a support network and who do you reach out to. I have to, of course, I'm with NAMI, right? So that's who I'm going to throw out there. But this is from personal experience as well. Let NAMI be your network. Let us be your support system. That's why we have the warm line available. So when you're feeling, if those days come up where it just feels like overwhelming and you just need a release, I'll be honest, even if you just need to call in and get a good cry in a safe, respected space, that's what we're here for. Our support groups, same thing. It's being connected with like-minded community members who may be going through something very similar. We can provide you with resources specific to your area. And you're connected with, similar to, Yvette is a peer, right? She is a caretaker, has been a caretaker. And so that's really who NAMI is you're being connected to peers, people who are living it and doing it and breathing it. And so I just encourage you, for any of you listening who feel like you just don't have that kind of network, let NAMI be that network for you. That's what we're here for. Let us help provide you with resources. The warm line can also do that. So absolutely, just know that you're not alone in any of this.
One of the other things I noted that I wanted to mention to you and your team was our staff went to the NAMI walk here in Southern California. It was a wonderful event. I'm not just saying that because I'm speaking today, but we did notice a difference when we go out to the community event. The individuals that attended this event were there for a purpose to seek resources. And there was a number of resources available to everybody that showed up to that event. And we noticed that people truly went for the resources and not for the promotional items. And they were there to seek the help and the resources and the information of what can I do. So that we felt that there was a difference at this particular event. So yes, NAMI is there for you.
Thank you. I appreciate you sharing that. And certainly swag is always good, but
yes,
yeah,
yes.
we want the community, right? That's
yes.
what we want, to connect with our community. So absolutely. I will definitely, like I said, for those of you asking for various resources, I will be sure to include that in the email I send out. That way you have it to look back at. I will also include Yvette's information as well. If any other questions come up in the meantime, you will have my email address, so you can reach out anytime. You can contact the warm line. Our team of peer support specialists will go the extra mile, always do the research, and help you find the best possible resource for your situation. So again, you're not in this alone. And I'll also send out, like I said, Yvette's information on the study. I think we have at least one person in the chat who is very interested in joining. So I'll share that with you too. Yeah, absolutely.
Our study is fantastic. This is study number 4 that we've done. Yes, it's for Spanish-speaking caregivers, but we welcome you into our study. We'll give you information related to caregiving and memory loss. And if you can help us spread the word, that would be ideal.
Yeah, absolutely. And as we close out, I just want to just remind each of you, burnout is real. We all have kind of our breaking point where we need to take those 10 or 15 minutes. So I just encourage you. I always call it sort of my toolbox or my my menu, right? And so create a menu for yourself, whatever that might look like. As Yvette said, if it's going out on your patio and looking at the flowers, or just having the sunlight hit your face, or drinking a glass of water, listening to some music, connecting with a friend, those things may seem very small and minute and that they're not going to help, but they really, truly do. And just start to recognize where that burnout may hit for you. And then have that menu readily available so that you can turn to those little things, because they will add up, certainly. Just like Yvette said, incremental changes, right? You're not expected to go give yourself 8 hours at the spa. I mean, we have to be realistic too.
Correct. One last thing I'd like to mention is, as the caregiver, understand the insurance. If there's insurance involved, take the time out to understand what does the insurance offer? What can your loved one get from that insurance? Like for me, once my father came out of the hospital, my concern was, can he go into a facility to rehab? If so, how many days? Different things like that. Try to understand what the insurance offers and get a better understanding.
That's great. Great advice. Thank you so much. I think that's all for now. I want to thank Patria for welcoming us all in and kicking off our webinar, and just for all the work you do on the Warm Line. And Cindy, our Spanish specialist, please reach out. She is ready to take your call and help you connect with resources. And Yvette, thank you just for sharing the personal with the kind of professional clinical side of things. I think it's just such a well-rounded presentation, and we appreciate your time, your knowledge, your experience, and for being here today.
Thank you so much.
Absolutely.
Thank you. I appreciate it. And thank you to your team for having me.
You bet. Everybody have a beautiful weekend, and be on the lookout in about a week for that email. We appreciate you all. Bye-bye.
Thank you. Bye-bye.